So this video is sort of an intermission between the two classes that I teach, Ethics Part 1 and Ethics Part 2, specifically about medical interpreting ethics with respect to the NCIHC, or the National Council on Interpreting in Healthcare. This video is also sort of a good review for any medical interpreters who are trying to review the medical interpreting codes of ethics. This will very briefly touch on the first 3 ethical principles discussed in the NCIHC Code of Ethics, and it will go over in more depth the other 6 ethical principles in the NCIHC Code of Ethics. So without further ado, we're going to go ahead and get started. So first, in terms of a recap of what was covered during Part 1, the 3 ethical principles that we discussed were accuracy, confidentiality, and impartiality. So accuracy is all about, being accurate, right? Interpreting everything accurately and completely, staying true to the message, and making sure to interpret the spirit of the message. The second ethical principle of confidentiality is about the privacy of the information that we often are tasked with interpreting in medical settings. And then the third ethical principle that was talked about was impartiality, which is basically opinions are like butts. Everyone has one, but chances are probably don't want to see it during a medical interpreting assignment, right? So you're allowed to have biases, beliefs, opinions, what have you, but when you're interpreting, you should really keep those things to yourself. And that doesn't just come out in terms of the words you are saying or interpreting, but also your facial expressions, any sort of preferential treatment that you're giving the provider or the patient, taking sides, things like that. So those are the first 3 ethical principles, and these are in the order of the way that they appear in the NCIHC their standards of practice, not the order that they appear in the Code of Ethics, just to be clear. And we also covered the first 10 standards of practice, speaking of the standards of practice. So those cover accuracy, confidentiality, and impartiality. So in terms of what we remember from our last lesson, so we had the big 3 medical interpreting organizations that author codes of ethics and standards of practice. And the NCIHC is only one of them. So though in class we focus on the NCIHC, there are actually 2 other medical interpreting organizations that have a national code of ethics and standards of practice for medical interpreters in the US. The other 2 are IMIA, which is the International Medical Interpreters Association. This is actually the first organization to author a code of ethics specifically for medical interpreters. Then we have CHIA, which is the California Healthcare Interpreting Association. CHIA is based in California, of course, and you'll notice that in the interpretation and translation profession, a lot of things come out of California that end up kind of setting the stage for things nationally for the profession of interpreting. And even though the CHIA standards, which contains their codes of ethics, their ethical principles for healthcare interpreters, and their standards of practice, which is basically the performance measures that are listed under the ethical principles in CHIA, even though they're from California, we still consider them as sort of one of the national standards. And the reason why I selected these 3 here is because these are actually what you get tested on. They're required knowledge for the U.S. national certification exams with CCHI, the Certification Commission for Healthcare Interpreters, and NBCMI, the National Board of Certification for Medical Interpreters. But when it comes to the NCIHC Code of Ethics, we also have something called the 3 core values. or as I put them here, the NCIHC Core Values 3. So the first one is beneficence. So this has to deal with the health and well-being of the patient. These are things that you should always have in mind. They're kind of like the 3 overarching principles above the code of ethics. We also have fidelity. Fidelity means faithfulness, like semper fi, always faithful. Fidelity to the original message, faithfulness to the original message. The third core value is respect for the importance of culture, recognizing that culture and language are intricately intertwined. If you're familiar at all with the Sapir-Whorf hypothesis, you'll know about this one. So we have our 9 ethical tenets with the NCIHC, but we also have these 3 core values, kind of like overarching all of these ethical principles. And then we have the standards of practice, which are kind of like the to-do list for how to, for instance, be respectful. So it's kind of like your how-to manual. So our 6th ethical principle with the NCIHC is respect. The interpreter treats all parties with respect. So here I have a picture of some Japanese business people, and it looks like, who knows, maybe an American businessman, and he's offering his hand to shake, but it is customary in Japanese culture to bow. And, the deeper the bow, the more respect you're showing that person. So I thought this was a good picture, but when I would use this all the time, people get really confused. When I would show it in quizzes and things, they would think this was for cultural awareness, which is one of our ethical principles as well that we'll be talking about. But I decided to change it to make it a little bit more, clear. Yes, Aretha Franklin. If you are not familiar with Aretha Franklin, you at the very least, from a U.S. cultural standpoint, you need to listen to Aretha. What I'll probably do is create like a card on this video so you can click on it and go straight to the video where you can hear Aretha singing. It's a great song. So respect is, just being respectful of people, right? There are lots of different ways that we show respect. And respect is also in a lot of ways cultural. The way you might show respect to someone, for instance, like I had before, someone who is Japanese versus someone who is American, there are different ways that we show respect. But another part of respect is also respecting a patient's autonomy. What is autonomy? Well, autonomy is the ability for people to make their own decisions and act independently. Unless you're interpreting for a baby. The patients we interpret for are not babies. They can make their own decisions. We are not there to make decisions for them. We are there to interpret. And we're there to facilitate their autonomy by interpreting for them. Because when people are able to communicate for themselves, they're able to make their own decisions more effectively. So the differences between respecting a patient's autonomy and disrespecting a patient's autonomy. So respecting a patient's autonomy looks like giving them a chance to disclose critical information first. For instance, if we know a patient is allergic to a medication, we don't just blurt out, but the patient's allergic to that. No. Unless, of course, the patient is literally about to be injected with that medication, in which case, you might need to do that. But generally speaking, in a lot of cases, these situations aren't super urgent. A lot of times the provider might be prescribing the patient a medication to which they're allergic, in which case they got to take that prescription, they got to go fill that script, they got to wait for it to get filled, and then they take it. So in that case, you might be able to give the patient a chance to disclose that information instead. So like I said, disrespecting a patient's autonomy would look like disclosing critical information without giving the patient a chance. Of course, in certain situations, like if a provider's literally ready to inject a patient with a medication they're allergic to, chances of that happening, pretty slim, I think. But if that were to happen, you probably wouldn't be like, I gotta let the patient say it first. So we do have to remember, like with all of our ethical principles, we weigh them, right? We balance them. We use our judgment. Respecting a patient's autonomy looks like allowing a patient to ask for clarification on a term, right? Provider uses a really complicated word. And then the patient says, what's that? And you just interpret it. You interpret the word and the patient said, what's that? And then you just interpret the patient asking, what's that? That's called respecting the patient's autonomy. However, disrespecting a patient's autonomy, and this is why we don't do this, one of many reasons, using a lower register term, you think the patient will understand better. I've often seen this happen with strep throat. A lot of times people will interpret strep throat as a throat infection, but that's not what the doctor said. There are all types of throat infections. And I realize that strep is more complicated in other languages, but if you interpret that and then the patient doesn't understand, they can always ask, well, what's that? What's strep? What is that? So don't just use that lower register term. It's not accurate and it's also not respectful. Respecting a patient's autonomy looks like interpreting a patient's explanation of a cultural concept. You don't have to immediately jump in and explain a cultural concept. You can allow the patient a chance to explain. So, like I said, disrespecting a patient's autonomy looks like just switching to third person and explaining a cultural concept immediately. Listen, this happens to me all the time because I interpret for a lot of folks from El Salvador. And a very typical food from El Salvador, well, they're called pupusas. If you don't know what pupusas are, you are missing out. But if I am interpreting for someone and they say, yeah, yesterday I ate a pupusa. Okay, well, first off, pupusa is a lot like taco. I'm not going to interpret pupusa into something. Like what? Like a filled tortilla? Whatever. I'm just going to say pupusa because there's really no way to interpret it. And so if the provider goes, wait, what's a pupusa? I interpret the provider's question, and then the patient can have an opportunity to explain that. But if the patient is unable or unwilling to explain, okay, well then maybe I will explain what a pupusa is. But generally speaking, I allow the patient to explain first. Speaking of culture, our next ethical principle is cultural awareness. NCIHC says the interpreter continually strives to develop awareness of her or his or their own and other, including biomedical cultures, encountered in the performance of their professional duties. Now, what's up with this picture, Kelly? Well, you've probably heard the phrase, variety is the spice of life. And this is one of the things I love about living in the United States. We're very multicultural here. It makes things very interesting. And let's say if I want to get a little taste of, let's say Ethiopia, I can go to the neighborhood right next to where my mother-in-law lives and be immersed in a culture different from my own. A lot of people get confused, though, by this part here that says biomedical. Well, medical culture is a thing. One of my favorite examples of this is actually sports medicine, which is closely related to physical therapy. When you go to interpret at a sports medicine facility that also provides physical therapy to non-athletes, they have a particular kind of culture that is very much akin to sort of like US gym culture. Lots of bro and bruh and reps and even specific jokes and slang that you probably wouldn't find in many other medical settings. It's a little bit of an extreme example, but each medical specialty and being in hospitals and clinics in general have some common cultural threads. There's even such a thing as organizational culture. I definitely noticed this as a freelance interpreter going to different medical facilities. You kind of get a feel for the culture of that particular place even. And being sensitive to that culture and educating yourself about that culture is part of your ethical responsibility. You'll even note here that it says, cultures encountered in the performance of their professional duties. Well, hey, listen. Here in my area, we have a pretty awesome LGBTQ community, including a Spanish-speaking LGBTQ community. LGBTQ culture is a thing, and it's something that, even as a member of the community myself, I've had to educate myself about in the carrying out of my duties as a medical interpreter. Yes, you may need to become more educated about your own culture. There are cultural beliefs about health and treatments that often come into play when interpreting in medical environments. And the only way that we can, 1, interpret a message, taking into account its cultural context, and 2, be prepared to step into that cultural mediator role, is to have a heavy helping of cultural awareness. So our sixth, it said 6. I think the last one was 6. It's okay, Kelly's numbers are messed up. But our next ethical principle is called maintaining boundaries. Sometimes you might also see this listed as role boundaries. It says, the interpreter maintains the boundaries of the professional role, refraining from personal involvement. So look at this picture here. We have this person. It looks like they're standing on the side of the road outside of the white line. Now what happens if they go in between the yellow and white lines? Well, they could get hit by a car. That's the space for cars, not for pedestrians. And you know what? Heck, maybe off the road we have a fence in that grass there. And then behind that fence is a field of angry cows. What happens if you jump the fence and hop into the cow pasture? Well, you might get attacked by a bunch of angry cows. But that's your fault. You went into a space that was meant for cows, not humans. Okay, don't mean to victim blame there, but might seem like an extreme example, but apparently some people have related to that example. I grew up in the country. I relate to that example too. So we have 4 roles of the interpreter: conduit or message converter, clarifier or message clarifier, cultural broker or cultural clarifier, and advocate, also known as patient advocate. So you have to ask yourself, if you're doing anything outside of those roles, am I really being an interpreter right now? Each of those roles has its own boundaries or limitations. It's your job to stay within them and to know when to switch between those roles. Each of those roles are more involved than the last one, and you shouldn't be any more involved than the most involved role, which is the advocate role. So I've had patients ask me for my contact information. I've even had providers ask me if I could bring the patient to their next appointment because they were having transportation problems. No. I live in a major city, but this town is a lot smaller than you'd think. I interpret for a lot of the same patients and the same providers. But no matter how many times I interpret for someone, I do not give them my contact information. That's a conflict of interest. I'm always super apologetic and super kind when they ask, explaining that it's part of the medical interpreter code of ethics. Now, a lot of times people get these ethical principles confused: impartiality and maintaining boundaries. A lot of times they look very similar when we're violating these ethical principles. But the thing about impartiality is we're not supposed to be counseling. We're not supposed to be advising. We're supposed to limit our conflicts of interest. We're not supposed to engage in preferential behavior. And listen, we're allowed to have biases, beliefs, values, and opinions, but they shouldn't come out in our interpretations or in our faces while we're interpreting, or in any other way. Now, maintaining boundaries looks like stepping outside, when you don't maintain boundaries, looks like stepping outside of your role as an interpreter. So let me ask you this. Under impartiality, if you're counseling, aren't you stepping outside of your role as an interpreter? So counseling is under impartiality because, well, you're sharing your opinions of what you think the person should be doing. But it's also stepping outside of your role as an interpreter. So counseling is technically not being impartial and not maintaining your boundaries as an interpreter. So a lot of times there is some overlap here. Maintaining boundaries. When you're maintaining boundaries, you should limit your personal involvement. You should also, and this is incredibly important, you should not create expectations that the interpreter role cannot fulfill. So if you push a patient in a wheelchair, when someone asks you to, well, then they might expect the next interpreter to do that too. So impartiality is all about exhibiting preferential behavior and letting those biases, beliefs, values, and opinions interfere with your interpretations, whereas maintaining boundaries have to deal more with the roles and the responsibilities within those roles and stepping outside of those. Similar, but different. Our next ethical principle is professional development. So the interpreter strives to continually further his or her or their knowledge and skills. NCIHC, if you're watching, I want to let you know you need to switch away from that binary language in your codes of ethics and standards of practice, because there are people out there who do not use he or she pronouns. Anyways. Kelly, why is there a lobster on this slide? Well, listen, I'm about to drop some knowledge on you. Did you know that lobsters never stop growing? So you want to be like a lobster. You want to never stop growing. That is what professional development is all about. And you know what? I'll be real with you here with this salt and this lime and this, looks like some bay leaves or basil and some onion on there. It looks like this lobster might be about to stop growing soon. Someone's going to eat him, but Or maybe the lobster's preparing a meal. We have no idea. But the idea here is lobsters, they don't stop growing while they're alive. Be like that. Always strive to be the best you possibly can be as an interpreter. I really think the people we interpret for deserve that. I really do. Our second to last ethical principle is professionalism. And it says here, the interpreter must at all times act in a professional and ethical manner. Now, this doesn't mean you have to show up in a 3-piece suit and tie to interpret for every assignment. That being said, showing up in jeans and a torn t-shirt probably isn't a good idea either. But professionalism, I think, is more about how you conduct yourself. And being professional is all about having integrity. Being honest. You have strong moral principles. And in the context of our code of ethics, it's following our code of ethics, which is essentially the sort of agreed upon moral code for interpreters. That's the big difference between a professional interpreter and an untrained or an ad hoc interpreter. A professional interpreter abides by the medical interpreting codes of ethics. This ensures a consistent quality of performance, consistency across interpreters. That's the goal. So we talked about honesty. Being unprofessional might be things like accepting bribes. Don't know how that would happen in an interpreting setting, but I got to put it out there. It could be taking advantage of your relationship with medical providers. When you're an interpreter, especially if you're interpreting for a lot of the same providers, you start to develop a little bit of a relationship with them. You know who they are. They know who you are. Don't leverage that to your personal benefit. That's not professional. Misrepresenting your skills. That's another big one. Another big thing of not being professional. Honestly, it's a huge difference between professional and unprofessional interpreters. Professional interpreter will accurately represent their credentials. Can't tell you how many times I've heard interpreters who receive their certificate of completion from a training program and start saying they're certified. Even if you don't mean to misrepresent your credentials, it doesn't look professional. So always make sure if you only have a certificate of completion from a training program, you have your certificate of completion. You are not certified. You are not certified until you sit and pass the medical interpretation certification exams from CCHI or NBCMI. So these are all a whole long list of really bad things that I hope none of us ever engage in. So just be professional. Use your best judgment on that. Show up like you care. There's nothing that really gets under my skin more than, people who show up for interpreting assignments and look like they just rolled out of bed. It's a lack of respect to the patients. And I'll tell you, when I show up in my nice blazer and everything for some patients, sometimes they say, oh, look who they sent me. Oh, and they feel special. I want people to feel special when I show up. I don't want them to feel like they're being punished, okay? All right. So the last ethical principle in the NCIHC Code of Ethics is advocacy. So advocacy is probably one of the toughest ethical principles for a number of reasons. So if you've ever seen any of those movies with in a sort of medieval setting with knights and kings and queens, I feel like this is something that happens in every one of them. There's always this situation where a brave knight stands up and says, "Don't worry, my lady, I will defend your honor." Okay. So being an advocate is a little bit like that, but way less dramatic. Okay. So the NCIHC says when the patient's health, well-being, or dignity is at risk, the interpreter may be justified in acting as an advocate. So this ethical principle tells us when we may be justified in stepping into that fourth and most involved role of the medical interpreter, the advocate role. Now, I'd like to draw your attention to this document from the NCIHC. Here we have the National Code of Ethics for Interpreters in Healthcare. This is from page 19. But there's also an additional document. It was released in February of 2021, and that document is entitled Interpreter Advocacy and Healthcare Encounters, A Closer Look. It is amazing. In fact, they recently had a recorded webinar where they went through this document. Oh, you're so lucky. I didn't have that when I started out as an interpreter. From the National Code of Ethics, they say advocacy is understood as an action taken on behalf of an individual that goes beyond facilitating communication, with the intention of supporting good health outcomes. Advocacy must be undertaken only after careful, thoughtful analysis of the situation and if other less intrusive actions have not resolved the problem. So, in terms of what this means, in that document I just mentioned, Interpreter Advocacy and Healthcare Encounters, A Closer Look, you can find it on the page on the NCIHC website that has the Interpreter Codes of Ethics and Standards of Practice. In this document, they say that an act of advocacy must meet two conditions. It must, 1, support the interest of the person, and 2, do more than just point out a problem, but also seek to persuade those with the authority to resolve the issue to do so. So advocacy is ideally a collaborative approach. So beyond facilitating communication, beyond just informing someone that a problem exists. An example? Well, I mentioned that one before about where the patient's about to be injected with a medication that they're deathly allergic to. That provider literally has the needle right at the patient's arm, okay? Let's say you've already informed the provider that the patient is allergic to the medication, but maybe, maybe they're not listening to you. Maybe they didn't hear you. Maybe they're in their own world. And that needle is about to go into that patient's arm. An example of advocacy would be yelling out, "Stop! Don't do it! The patient is allergic to that medication and I don't know what's going to happen to them." So you're fulfilling those two requirements. You're supporting the interest of the person, and you're doing more than just pointing out the fact that there's a problem. You're also trying to persuade the person who has the authority to fix that problem, to not inject that patient with that medication, to not inject them. And you're not just facilitating communication, okay? So the NCIHC says that when a patient is facing physical harm, it's usually pretty clear-cut and dry when we have to intervene, especially if we know it's urgent and critical, like the example I just gave you. But this is something that I will actually be discussing more in a later class if you have class with me. If not, there is that amazing video by the NCIHC. I haven't even seen it, but I already know it's amazing. Outlining that document, Interpreter Advocacy and Healthcare Encounters, A Closer Look. I will post the link in the description of this video as well. So I highly encourage you to watch that, whether you are a student in one of my classes who will be hearing an explanation of the advocacy role or not in this class. You will be hearing it later, I promise. So these are the 9 ethical tenets from the NCIHC Code of Ethics. We have accuracy, confidentiality, impartiality, respect, cultural awareness, role boundaries, professionalism, professional development, and advocacy. A quick note, professionalism and professional development, according to the NCIHC, are 2 separate ethical principles. Professionalism is all about how you conduct yourself with integrity, following the medical interpreting codes of ethics, whereas professional development is being a lobster, always growing, always seeking to do your best, expanding your knowledge. So even though they sound similar, they are different. And we need to remember there are actually 3 widely recognized codes of ethics for medical interpreters. For spoken language interpreters, these codes of ethics are required knowledge for both the CCHI and NBCMI national certification exams in the United States. But I actually have another video in which I go over these differences, and I'm probably going to post a link here for you to see. If you are a student of mine, I will see you in class for Ethics Part 2. If you are not a student of mine, thank you so much for watching. Thank you so much for being that professional development lobster and trying to educate yourself more about medical interpreting ethics. I have a whole bunch of really interesting videos on my channel about medical interpreting ethics. So if you'd like to watch those, feel free to check my channel and make sure to subscribe.